Fluid therapy is administering a set of fluid directly into the blood vessels of a patient who has difficulties in eating or surgery. Catheters are fixed inside the blood vessels of such patients to supply the fluid. However, the intravenous administration that utilizes a catheter could result in the blood exposure when removing the needle for an intravenous drip and incur a needle stick injury. Therefore, medical team needs to be careful when conducting such medical procedures. To address such problems, Medifirst has developed a safety IV catheter with a blood-stopping aid system embedded inside its hub to stop the blood from coming out and to prevent secondary contamination when removing the needle. Medifirst's blood-stopping safety IV catheter consists of the catheter part, the blood-stopping part, the safety functioning part, and the needle part. This medical product is equipped with a new safety function that automatically puts the needle in the hub without additional handling, so as to prevent a needle stick injury. The innovative blood-stopping function and finely back-cut needles guarantees smooth insertion with minimal pain, and the flexible and resilient polyurethane tube leaves minimal damage to the blood vessels, making the IV catheters from Medifirst the best of its kind. First and foremost, when using the IV catheter, decide the point where you want to insert it. Then tie a tourniquet or rubber string 15 to 20 centimeters above the point before wiping out the insertion point with a cotton swab and alcohol. The sharply back-cut needle will leave minimal pain as compared to the existing needles when inserted. After the insertion, untie the tourniquet. When the needle is removed from the catheter, it passes through the blood-stopping aid system, closing the gasket to stop the blood from coming out. In addition, as the needle is safely stored inside the needle hub and the shielding function is activated when it is detached from the catheter, it is completely sealed to prevent secondary contamination and user errors. It's time to insert the connecting tip of the supply tube to the catheter. The blood-stopping holder will be pushed to open the gasket and let the fluid flow into the blood vessel of the patient. Even if the fluid set has to be changed due to the restoration of blood reflux, just disconnect the connecting tip from the catheter. The blood-stopping holder in the catheter will be pushed back to close the gasket to stop the blood from coming out 1 or 2 times before a new fluid set is connected. The catheter tube is made of thermoplastic polyurethane, which means that the tube becomes soft and flexible as compared to the existing Teflon catheter, preventing any damage to the inner wall of the blood vessels even when the patient moves. Position the catheter and complete the dressing